Hello everyone. Today we are going to be looking at what is diabetic retinopathy. So without further ado, let's get into the video. Diabetic retinopathy is an eye disease caused by diabetes. Diabetic retinopathy is a condition caused by damage to the blood vessels in the light-sensitive tissue at the back of the eye, retina. Diabetic retinopathy may initially cause no symptoms or only minor vision problems. However, it has the potential to cause blindness. Anyone with type 1 or type 2 diabetes can develop the condition. The longer you have diabetes and the less well your blood sugar is controlled, the more likely it is that you will develop this eye complication. What are the symptoms of diabetic retinopathy? In the early stages of diabetic retinopathy, you may not notice any symptoms. As the condition worsens, you may experience spots or dark strings may appear in your vision, floaters, vision hazard, variable vision. There are dark or empty spots in your vision, loss of vision. The best way to avoid vision loss is to keep your diabetes under control. Even if your vision appears to be fine, see your eye doctor for a yearly eye exam with dilation if you have diabetes. Diabetes during pregnancy, gestational diabetes, or diabetes prior to becoming pregnant can increase your risk of diabetic retinopathy. If you are pregnant, your eye doctor may advise you to have additional eye exams during your pregnancy. If your vision suddenly changes or becomes blurry, spotty, or hazy, see your eye doctor right away. What are the causes of diabetic retinopathy? Too much sugar in your blood can cause blockage of the tiny blood vessels that nourish the retina, cutting off its blood supply over time. As a result, the eye makes an attempt to form new blood vessels. However, these new blood vessels do not develop properly and can easily leak. Types of diabetic retinopathy. Early diabetic retinopathy. New blood vessels do not form in this more common form, known as nonproliferative diabetic retinopathy, NPDR, proliferating. The walls of the blood vessels in your retina weaken when you have NPDR. Tiny bulges protrude from the smaller vessel walls, occasionally leaking fluid and blood into the retina. Larger retinal vessels may also begin to dilate and become irregular in diameter. As more blood vessels become blocked, NPDR can progress from mild to severe. Sometimes, retinal blood vessel damage causes a buildup of fluid, edema, in the retina's center, macula. If macular edema impairs vision, treatment is necessary to avoid permanent vision loss. 2. Advanced diabetic retinopathy. Diabetic retinopathy, also known as proliferative diabetic retinopathy, can progress to this more severe form. Damaged blood vessels close off in this type, causing the growth of new, abnormal blood vessels in the retina. These new blood vessels are fragile and have the potential to leak into the clear, jelly-like substance that fills the center of your eye, vitreous. Scar tissue from the formation of new blood vessels can eventually cause the retina to detach from the back of your eye. Pressure can build up in the eyeball if the new blood vessels interfere with the normal flow of fluid out of the eye. This buildup can cause glaucoma by damaging the nerve that sends images from your eye to your brain. Diabetic retinopathy can affect anyone who has diabetes. The following factors can increase the likelihood of developing the eye condition. Diabetes has plagued me for a long time. Poor control of your blood sugar level. Blood pressure that is too high. Tobacco use. Pregnancy. High cholesterol. Diabetic retinopathy complications. Diabetic retinopathy is characterized by the formation of abnormal blood vessels in the retina. Complications can result in severe vision problems. 1. Vitreous hemorrhage. The new blood vessels may bleed into the clear, jelly-like substance that fills your eye's center. If the amount of bleeding is minor, you may only notice a few dark spots, floaters. Blood can fill the vitreous cavity and completely block your vision in more severe cases. Vitreous hemorrhage does not usually result in permanent vision loss. Blood usually clears from the eye in a few weeks or months. Unless your retina is damaged, your vision will most likely return to normal. 2. Retinal detachment. Diabetic retinopathy is characterized by abnormal blood vessels that stimulate the growth of scar tissue, which can pull the retina away from the back of the eye. This can result in floating spots, flashes of light, or severe vision loss. 3. Glaucoma. New blood vessels can form in the front of your eye, iris, and obstruct the normal flow of fluid out of the eye, causing pressure to build up inside the eye. This pressure has the potential to harm the nerve that transmits images from your eye to your brain, optic nerve. 4. Blindness. Diabetic retinopathy, macular edema, glaucoma, or a combination of these conditions can result in total vision loss, particularly if the conditions are not well managed. Preventing diabetic retinopathy. Diabetic retinopathy cannot always be avoided. Regular eye exams, good blood sugar and blood pressure control, and early intervention for vision problems, on the other hand, can help prevent severe vision loss. Reduce your risk of diabetic retinopathy if you have diabetes by doing the following. Make healthy eating and physical activity a daily habit. You may need to check and record your blood sugar level several times per day, or more frequently if you are ill or stressed. Inquire with your doctor about the glycosylated hemoglobin test. Maintain a healthy blood pressure and cholesterol level. Smoking increases your chances of developing diabetes complications such as diabetic retinopathy. If your vision suddenly changes or becomes blurry, spotty, or hazy, contact your eye doctor right away. Remember that diabetes does not always result in vision loss. Taking an active role in diabetes management can help you avoid complications. And that's it for today, everyone. Hope you guys learned a lot about diabetic retinopathy and how to avoid it. See you guys tomorrow with another exciting health tip video. Subscribe to our channel and click on the bell icon to receive instant updates on our videos.